My name is Colleen Kraft, as Susan already said, and I am an infectious disease clinician as well as a medical microbiologist. So I think a couple of things I wanted to start out with that I also mentioned when I was on Hank Johnson's telehealth meeting last night was to just really focus people towards sources of truth. I know that all of you are trying to be the source of truth for the public in terms of what they are learning and what they need to know to keep themselves safe. And so there's a couple places that I keep referring our healthcare workers, are my friends, family, in order to have that source of truth. One of the things that we're also have been developed through our Center for Emergency Response and Preparedness, also known as CPAR, is the COVID symptom checker. And this is something that I think is helpful to somebody at home that doesn't really know what to do with the symptoms that they're having, but yet wants to feel reassured that they should or shouldn't have medical attention. The website for this is c19check.com. I'll say it one more time, it's c19check.com. And this is a really good way to have symptom monitoring. It's very easy to use on your phone. And basically what you do is you put in your symptoms, it asks you other questions, and then it sort of tells you what you should be doing. The other source of truth or resource that's more of a verbal resource, since not everybody is tech savvy or wants to just interact with the internet, is that we have a hotline at Emory Hospital. I shouldn't say hotline, it's a resource line. It's not 24 hours a day, but it's 404-71-COVID. And that is a resource if people feel like they need testing or other resources within the Emory healthcare system, or if questions can be answered by our medical professionals. I know that you guys are up on the news on some of this testing as much as I am, but our initial testing was sent out to national referral laboratories, which would come back in 7 to 10 days. That is a difficult turnaround time when we're trying to make clinical decisions. And so now, because we're doing completely in-house testing, our testing is turned around in 24 hours. So I want to hit back to this very redundant message that I tend to say every time that I'm talking, which is there are lots of things to protect us and not just masks. So something like this, hand sanitizer is really important. So surfaces need to be cleaned. Hand hygiene is very important to do before and after touching dirty surfaces. Face hygiene is critical. In terms of cloth masks, I think it helps reduce the saliva that's generated, but remember this is very much a droplet thing. So if you're far enough away from somebody that they can't spit or cough or sneeze on you, then you should be safe. Asymptomatic spread is something that already occurs with coronaviruses and has been occurring since we've known about coronaviruses in general, not just COVID-19. And I would say that asymptomatic spread is much less worrisome than symptomatic spread. Somebody that's not having symptoms and is not coughing, sneezing, rubbing their face, touching surfaces with their dirty hands is much less likely to spread this disease because they're sort of controlling their secretions and their sickness. And so again, for those who are asymptomatic and those who are interacting with people that we don't know whether or not you have COVID, face hygiene, hand hygiene, don't trust surfaces unless you've cleaned them. Emory Healthcare is in critical need of disposable or reusable gowns, and we are in critical need of any type of mask. We have a great partnership right now with Georgia Tech, who are basically 3D printing face shields for us. And so what that would look like is you'd be wearing your mask, but then you'd have a shield over it. And not only does that help, protect your mask, but it also does sort of a total protection of your face. And so those are reusable and those can be cleaned, but our masks that we wear over our face are the ones that tend to run out the most. I think that this in the whole scenario was a worry that kept me up at night for the last 5 years that we're now engaged in every day. I think the thing that always worries me the most that has remained with me since Ebola virus disease is a large percentage of our healthcare workers getting infected. That always scares me the most because that leads to a lot of distrust. So far, we have felt very good about our processes, and people have felt very good about their processes, and they've immediately jumped into basically being as paranoid as we were during Ebola, which has been very helpful. And I've also seen that a lot in the community, and it's been good to see people's understanding that their environment can be dirty and transmit viruses to them.